Hi, everyone. Thank you for joining us today for today's panel discussion on the COVID recovery, topics to include the economic recovery, public health, and racial justice. I'm your moderator today, Megan Imperial, the policy chair for the San Francisco Women's Political Committee. And I would like to welcome our panelists, Carmen Chu, Joy Jackson Morgan, and Veronica Shepard. Thank you so much for being here today. I'd like to open up this discussion with a question. So please introduce yourselves and tell our audience what you are currently working on during the COVID issues in your field. And we can start with Carmen.
So good afternoon, everybody. So glad to join all of you today for this great panel. I want to thank you, Megan and SFWPC, for helping to host this and helping to make sure that this important conversation comes forward. So my name is Carmen Chu. I serve as San Francisco's elected assessor. I think like many of you, we had to very quickly change to a remote work scenario with our office when we had the shelter in place be put into place in March. I think for us, we were able to do that relatively quickly, and 98% of our operations is currently happening somewhere off-site and not in person. But that being said, I think what's really important to know is that we have been working really hard to make sure we try to continue to do our work, primarily because we know that the revenue impact of our work has a very, very large kind of dispersed impact in the whole city in terms of the services that we're able to offer, the types of programs that we're able to support people with, especially during COVID-19. And so we're continuing to do that. I think on another note, I think I also serve as the Economic Recovery Task Force's co-chair. So very much I'm excited to speak to you more about the work of the task force coming up in our additional conversation. And the last thing I guess I'll say in terms of introduction is that I am a brand new mother of a 14-month-old, not year old, but she's growing very quickly. And I think more than anything, I really am truly seeing and appreciating what it means to be part of a working family, especially during COVID-19, because there are so many different challenges associated with work-life balance, among other things. And I do say that I want to recognize that I consider myself in a very fortunate place because I have my health, I have a job, and I think that that is so much more than a lot of people are facing at this moment. And so I think despite the challenges that we all face, we always have to count our blessings in terms of things that we do have and recognize that that there are many people who need much more in terms of help than where we are. So very, very happy to be part of this conversation and look forward to hearing from the co-speakers as well today. Thank you.
Thank you, Carmen. Let's go to Joy next.
Morning, everyone. My name is Joy Jackson Morgan. I am the executive director of 3rd Street Youth Center and Clinic in Bayview, Hunters Point. I am a second generation Hunters Point native. So yes, a unicorn in the city as being a San Francisco native. But during this time, 3rd Street has really focused on our young people and addressing the needs that youth have been coming up with, primarily with housing. Housing's been a huge issue for our young people. Food has also been an issue. So we've gone from just having our food pantry to having food delivery for our youth and their families. We're currently serving about 50 youth and families per week. And then we've also been trying to just keep our young people engaged, right? This has been a very hard time for them adjusting to distance learning and not having the certain outlets that they're accustomed to. And so we've continued our youth development programs. Staff has been phenomenal in keeping our young people engaged and active and connected to their peer groups in ways that, this is not the norm for any of us, right? We're used to being outside. We're used to being able to go where we want, and now being confined to Zoom or the many different platforms that we've all have come to be recognized with. But it's just been particularly difficult for young people, I think, because this is their time in development where they're supposed to be social, and not having these normal things has really taken a toll. So we've been trying to make sure that our behavioral health services are available to them. Our clinic, unfortunately, has been closed since March. But we're in the process of trying to get our clinic reopened in the next few weeks so that we can start delivering some of our medical services as well. So really just trying to stabilize our young people in the best way we can and help them through this very difficult time, both economically, food, sheltering, health.
Definitely. Thank you, Joy. And then last but not least, Veronica.
Good morning, everyone, and good morning to my panelists. My name is Veronica Shepard. I'm with the San Francisco Department of Public Health. My primary work is around food security and racial equity. I support primarily the African American Faith-Based Coalition. It's a coalition of 21 plus churches across the city of San Francisco with primarily African American congregants. COVID-19 threw the population of people I support into a whirlwind. Because shelter in place hit, there was not a lot of city plans for how people would be sustained. The coalition I work with, because of its infrastructure, we developed a partnership and was able to provide meals immediately across the city. As of today's date, they have delivered over 110,000 meals across the city, and they're feeding almost 1,000 households each week. It's been quite a challenge. For those of you listening that don't know, the African American community, Joy kind of spoke to it, we have been suffering pre-COVID, and there's been huge disparity issues and racial inequity. So the shelter in place and the coronavirus has just added other additional issues on top of what was already going on. On top of the heightened racial climate, it's just like this stew of a lot of issues that people are facing. We have seniors who this isolation is impacting them mentally and emotionally. We have hunger issues that hit immediately, but we're addressing that. We have children in households that can't go out, as Joy is talking about. I have families where there's 10 people in a household and only one person is working. I mean, there's so many issues that are spiraling all at the same time. So part of my work and role is to support people, help them to stay safe, provide resources and information, and continue to just be that light as a beacon for people who were living complex lives pre-COVID and continue to live complex lives in this pandemic.
Thank you, Veronica. Thank you, everyone, for those good introductions. Also want to just quickly note that anyone watching from home, you can feel free to leave a question in the chat box, or if you're watching on Facebook, leave a question there for our panelists, and we'll get to those at the end. So wanted to shift it over to Carmen, and if you can talk more about how was the Economic Recovery Task Force created, and what is the purpose of this task force?
Sure, absolutely. So I think maybe folks may have heard the task force was actually a convening of the mayor as well as president of the Board of Supervisors, Norman Yee. The intent when the task force was created was really to pull together people on the ground to provide feedback and information and ideas about how San Francisco can best position itself to be able to recover from COVID-19, from shelter in place as best as we could. I think as we started to learn more about the pandemic, learn more about the disease and how it was spreading, I think the picture has become that much more complicated. And I think you see that with the most recent resurgence in terms of COVID-19 and the health indicators sort of coming back to a negative when it comes to hospitalizations, as well as the number of people who are contracting it. And so it is going to be a big challenge in terms of how it is that we deal with it as a city. I think in general, San Francisco has been really trying to take a measured approach to how it is that we are thinking about economic recovery, and not only measured approach, but making sure that we're grounding how it is that we're approaching both where we're directing our services, how we're kind of making sure that we're providing different support based on information on the ground. So actual data, health data, statistics, information that really helps us to understand what's happening from a health perspective. But I think as Veronica and Joy mentioned also, I think there is a really strong recognition that COVID-19 really is even though the disease does not discriminate, what we're seeing is that some of the underlying inequities that exist are being exacerbated by the disease, right? And so we are seeing, I think, as both people mentioned, instances where people who have the least kind of income security, the people who are least able to take a break from their job, the people who are not able to telecommute, the people who don't have savings, and people who have poor chronic health conditions are the ones who are really most impacted by COVID-19. And so we see this from the Latinx community, where they are 15% of San Francisco's population, but they make up about half of the people who currently are testing positive in terms of COVID-19. We've seen a disproportionate amount of deaths being Asian Pacific Americans. I think Veronica and Joy both mentioned some of the impacts in the African American community. And not only that, we're also seeing, I think in the Asian community, also a rise in terms of xenophobia. A lot of people who are being blamed for the creation of COVID-19 and for the spread of it, even when we all know that that's patently untrue. And so I think we see some of these disparities. I think one of the partners that we have going forward in our W Challenge, for example, and kind of recognizing women is the Department of the Status of Women. And I'm not sure if folks have seen, but they put out a report recently that I think was pretty telling, which spoke to how COVID-19 is also exacerbating inequities amongst women. Right. And so, again, women tend to be concentrated in lower wage jobs and jobs that may not have as much ability to do telecommuting or some of these other options that people currently have. We are also typically people who are going to be primary caretakers for young children and our seniors and our parents and other people in our family as well. And so there's a disproportionate impact also among women. So I think in terms of the task force's work, we really are concentrating on saying, what kind of policy decisions can we be pursuing as a city to help enable recovery, and thinks about equity while we're at it? If we are going to have scarce resources to put to different programs to support our workers, families, San Franciscans as a whole, where should we put that, understanding that there is also a disproportionate impact on how COVID is really hitting our communities? I think the city has already done a lot of different works in terms of the immediate need. It's never enough. There's not going to be enough because this is such a significant challenge for all of us. But I do think that some of the work that Veronica spoke about, that Joy is doing in terms of supporting our families and our kids in terms of food security, among other things, are some of the immediate responses. But that doesn't mean that that's where it ends. We still have to think more intermediate term as well as long term about how the city invests. And so that is what the Economic Recovery Task Force is trying to do, is really putting the on the ground experiences together, coming up with a coherent plan and strategy for how the city might want to approach reopening going into the future.
Definitely, very impactful. So I want to bring it to Veronica, and knowing that health disparities are tied to systemic racism, and this is a public health issue that disproportionately affects people of color and Black and brown bodies, what can our leaders do and those in power do to change this tide?
I don't think we have enough time. I'll give it my best shot, okay? It's a loaded question. For our communities, and I'm specifically talking about African Americans, we as leaders in this city, particularly at the higher levels, have to be honest about the structural racism and violence that's been perpetuated against our people ever since slavery. We have to be honest of how that looks and how it shows up in each of our systems. We have enough data on the Black experience to build cities about, but we don't seem to shift on how the racism and its structure is continuing to keep these barriers and these hurdles high so our communities can't thrive. Unless we change the program project mentality, we're not really pulling out the roots of the racism. We're just doing check boxes. And they're always like a Band-Aid. They never really resolve the problem because we're not going deep enough and we're not being honest enough to say that we're putting systems in place that perpetuate the inequity. Until we as leaders all come together at the highest level and have honest conversations that will be probably very uncomfortable, because it's going to reveal how our own biases stand in the game, to be quite honest. And we have to own up to the fact that a lot of these systems that are in place, we're protecting them at the highest level. Because people who make up 5% of a population, but have the highest health disparities, the worst education outcomes, the highest rates of mass incarceration. I mean, I could go on and on. Something is intentionally wrong there. Half of our population is homeless, is Black. It's not even that many of us. So what is structured in place that continues to perpetuate this? And how are we protecting it? That it keeps going. We got to be honest. Otherwise, we were going to continue to fund programs that are not sustainable because they're not designed to be. They're not going to dig out the deep root of the problem. This entire country has been functioning in systematic structural racism and violence against Black people. Now, we just got to own that. So it comes back to checking ourselves, what our own biases are, how do they show up in the day-to-day realities of what we've been assigned to do. You can't tell my community we're here to help you, and you need a heart transplant, but you give me a Band-Aid. How does that help my community? And yet we continue to do this. So somehow, until we as leaders at the highest level can sit down and be honest about what we're actually doing to Black people, and particularly right now with the racial climate that we're living in, it's like been unleashed against us. And yet we're still fighting to get basic needs, food, housing. We're struggling to get testing out here in our community. And yet, as Carmen spoke, the need is huge, but we're not being honest. And I think we've all been so conditioned to operate in our different slices of the pie, we don't see the whole picture. We don't see how all of our little ingredients are not actually creating the recipe we're trying to build. So I think we as leadership have to step back, honestly have discussions that continue to protect and perpetuate the racism, to dismantle it and actually make sure that everything we're doing is connected to some policy or some ordinance that dismantles the barriers of racism against African Americans.
Definitely. Thank you. So Joy, speaking on that, I know that you spoke a little bit in your intro about how this has affected your organization right now. So how has COVID affected your ability to provide medical and behavioral services to the youth?
Yeah, both Carmen and Veronica, like, I don't even know how I get to come after both of you who spoke so well about this, but I think health starts in community, right? And it is a community response, a neighborhood response, right? And when you start to take away some of the things that we're accustomed to have this sort of response, on top of the social determinants of health that we already had, it definitely puts us at a disadvantage, right? We need to acknowledge the role of these social determinants of health and how that relates to the disbursement of resources and the response from the city. As Veronica alluded to before, we are scrapping for resources, for testing. And so we've had to do all telehealth for our behavioral health services. That's not like a community model, right? We depend on relationships, right? It's a very village model, right? We depend on each other for our needs. We build rapport with youth. We take the time to build a rapport with youth, and then that gets taken away, both on the medical side and the behavioral health side. They trust us. We are almost like a boutique clinic, right? It is designed, it was created by community and by the youth to be the beacon for their needs. And so I think even when we talk about policy, I think we need to look at how there's racism in the decision making, and that we need to look at who's at the table, who has the power at the table to make these decisions, and to help bring community to the table so that they're at the forefront of the decision making, the solutions, and the progress. Like, how do we hold the city accountable to trying to address our needs without the community there? So I think when we look at these things moving forward, we have to, as Veronica said, and as Carmen said, we have to put our leaderships, our leadership, and faith in the community leadership to help with some of this policy and decision making going forward. That's the only way we're going to crawl ourselves out of this this hole that we're in.
Yep, definitely hear that and agree. And so, speaking about policy and good policy, budgets are often the foundation of good policy. And so, I want to open this question up for all three of you. How have you seen this city's or your organization's budgets affected by this pandemic?
Can I just start by saying I really want to appreciate what both Veronica and Joy said. I truly do think that when we talk about economic recovery, there's a piece of it that the task force is trying to deal with, which is what are citywide policies we should be thinking about. But I agree with Joy in terms of the community-based approach. It's really important. There are community leaders, networks, existing relationships that can only strengthen and either make that work or not work. And I think that that's really important to acknowledge. And I think to Veronica's point as well, I really appreciate the comment that she said about how we have to be willing to confront those really difficult conversations, because I really feel like whenever it comes to the conversation around race, it is very hard to talk about. It's very hard to be vulnerable and kind of talk about what you don't know, or to be fearful of saying the wrong thing. And that makes the conversation around race hard. But when we start to see kind of the outcomes that we talked about, whether it's sort of economic outcomes, health outcomes, and so on, they're tied to race, right? And so how do you kind of just say that it's not connected, right? And so I do think that it's important for us to begin taking those steps. It's hard to do, but I'm hopeful that we're going to start to have more conversations, and the more conversations we have and sustain conversations, not just for this month or next month, but continued, that we can actually see progress. I hope that that's going to be the case. And I know that it's the leadership of the city, but it's also in our communities and how we all interact and what kind of personal responsibility that we can all take with dismantling the systems that we have. In terms of budget, budget is incredibly tough for the city right now. And I think what we're seeing is a $1.7 billion budget deficit. And it's a lot because a lot of the economic activities that we have been able to depend on for our revenues have been drying up, right? So hotel tax, sales tax, some of these things that are tied to economic activity has pretty much just stopped, right? And so I think that's been a big challenge for us. From our organization's point of view, we're trying to figure out the best way possible to continue doing our work, because for folks who don't know, the assessor's office is responsible for property taxes, and our operation brings in about $3 billion of funding to the city year after year. And that helps to fund our social services. It's actually the largest source of general fund revenues for the city, in addition to public school and education, which is also really important. And so we really want to try to make sure as best as we can to continue those operations. But it's not going to be easy, because if we are to meet this budget deficit, it looks like potentially cuts. And, I think all of us are looking for areas where we can cut to help make balance that won't impact people and hopefully won't impact services. But for an organization like mine, where probably 80% of my expenses are people, that's hard to do. So I think that you're going to see that to be really true, especially with so many of our nonprofit partners, where it was already hard to begin with in terms of being able to kind of run the operations, to recruit and to keep talent and people in your organization, and to pay them something that helps them be able to survive in a high expense city. And now that we're in this situation, it's even harder. So I just want to acknowledge that is true. It's true for the city, and it's even more true for our nonprofit partners. So I'd imagine that we're going to have a very challenging time. But I think that being said, from my point of view, in our organization, we're committed to making sure that we do everything we can to continue bringing in the revenue that is fairly due to the city. And we're going to see a lot of challenges to that. But we are already seeing a lot of commercial properties and others, saying that COVID has had an impact. It certainly has an impact, but from a property value point of view, we don't think it has an impact for the fiscal year upcoming. So that is just, in my mind, understanding kind of where we're going to have challenges coming forward as a city. It's going to be tough. Thank you.
So I kind of jump in, Megan. For me, the answer is twofold because I work for the health department and a lot of the budgets were redistributed because of COVID. And then I work for community and people on the ground, and their budgets were just pretty much destroyed by a lot of this work. So, from the city's lens, from the health department lens, the new guidelines, the mental health money has been drastically reduced, which impacts our community huge because there wasn't enough resources for Black people and their mental health needs before COVID. So with the reductions that I saw from Gavin Newsom's office, it's going to have even a harder hit for our communities because, as I stated earlier, all of this impacts our mental and emotional health and well-being. We have people who are seniors that are isolated and are just not doing well because we're social beings, as I heard Joy and Carmen kind of talked about. This intersection of us being around people has impacted us all. So from the community lens, it's a huge struggle because you've got funded to do certain programs and certain projects that are going to kind of sub-support people, and yet people are sheltered in and can't come out. Our community also doesn't have access to technology like a lot of other communities. So those resources aren't always available. We live, as Black people, many of us live multi-generational. And so it's not just because we look at our programs are for the seniors or for the kids or for the working poor. We aren't looking at household level responses because we're all impacted. So if grandma's getting a grocery bag, all the 8 people that live in that house are going to live out of that grocery bag, which is probably going to be gone the same day they get it. So the programs that used to provide those have been impacted by the pandemic. So the resources aren't as great as they're trying them to be. It's changed over the last few months, but it's been a huge impact on trying to connect resources. As Joy said earlier, we as community people know each other and kind of build upon what we know we all have, but we're all still fighting for the same breadcrumbs. It ain't like Joy's program got an abundance of stuff and somebody else over here has it. Even the Y, our wonderful baby Y here, great resource to our community. And yet, they're just trying to continue to engage our community, families and seniors and all the people that they serve from an extended reach. So it has the question about the budget, it has a different impact with the people on the ground that we serve compared to the health department who's trying to take resources and redistribute them in an equitable way, but the need is so great. And they're still figuring it out with each new day. Things keep changing. We have federal guidelines that have impacted our budgets. So there's just layers and layers upon things that people have to think about daily. Thank you.
All right. I'm going to answer this question wearing 2 hats. And I'll start with the first hat as being the co-chair of the sugary distributor tax. And so, Ben, this is like my 3rd year as chair. And so like every year we put out these recommendations, trying to be as equitable and community focused as possible. And as a co-chair, I am worried about this planned shrinkage in the city. And when I say that, when we think about historically, when these things come up, Black and brown people are always at the tail end of this. Like, this is who's going to get hit the hardest. It's always going to be either, if it comes out of the fire departments, the police departments, or wherever, it's going to be in our neighborhoods. And so trying to make sure that in every decision that's being made around this planned shrinkage, that we are taking an equitable lens or an equitable approach. Director Shakira Simley just put out a COVID response, like not a workbook, but like I can't think of the word right now, but she just put out this great report about like how we should approach our economic and our recovery as a city. And I recommend people should read that. But then also, like, my other hat as a leader of a nonprofit, I am terrified because by this point in the process, nonprofit leaders would know what we're working with. And this delay is just what is adding another layer of stress, right? You're trying to keep your staff calm. You're trying to make sure that you are going to have money to be able to pay for the things that you've already planned for, right? You've already submitted your budget. Now you're waiting for your city counterparts to let you know if this is actually going to happen. You're trying to keep your populations that you serve calm in this. So it's a whole different level of stress for nonprofit leaders right now because we don't know what's going to happen. And all the things that we have grown to sort of trust and depend on are all at jeopardy. And I just want to say that, like, health is involved in all policies, whether it's education, transportation, whatever, whether it's intentional or unintentional. And so, like, we really need to focus on like how all of these policies and even the way these budget cuts comes down and what sort of impact it's going to have on the health of communities of color.
Yeah, definitely. That is so true. And so speaking on that, I think in today's debates, the public health recovery and the economic recovery are oftentimes pinned against one another. And so how do each of you envision a community where these two can be integrated to create prosperity? Go to Carmen.
I was going to let someone else take the lead first.
Whoever wants
to. Well, I think, in terms of tracking this, when you take a look at the reproduction rate of COVID-19, when you take a look at kind of what that rate was back in March, it was something above 3. So what that meant is that for anyone who had COVID-19, they were basically spreading it to 3 other individuals, right? And San Francisco, I think, in the Bay Area took a pretty quick and decisive action to do shelter in place in mid-March. I think it was faster than many other places. And I think that ultimately that did save lives because it helped to slow the spread pretty quickly. But that being said, when you take a look at kind of the trajectory of reproduction rate for COVID-19 since that time, it dropped dramatically after shelter in place went into order. And for a very, very long time, it was under 1, which is a good thing. You want the number to be under 1. As of probably around the beginning of June or so, that started to inch up, and we're now likely above 1. And so that's kind of where we are in terms of the reinfection rates. That's not a good thing. We want to bring that number back down. Otherwise, we're going to continue to see spread pretty significantly in our communities. And so I think the one thing that I tell you that because what happened that kind of drove that number down at that point was 2 things. One was that we closed a lot of businesses, right? So a lot of economic activity or general activity, recreation also was basically shut down. We said you have to shelter in place, right? The second thing that happened was that I think, at least I know for myself, psychologically, we were seeing what was happening across the country and around the world, what was happening in New York. And we were all saying, oh, we better take precaution because we don't want to see that happen here. We don't want to see, lines of ambulances going into our hospitals with having us having to make decisions about who to treat and who not to treat. We didn't want to be in that situation. And so I think many of us took a lot of precautions, and all of that combined really helped to flatten the curve. When we started to reopen the economy up in mid-May or so, I think a few things happened, right? I think, number one, more economic activity was happening. So more people were kind of coming in contact with one another. But I think also, a lot of people just started to let their guard down more, right? And so I think it was a very natural thing because we've been cooped up. We've been, we've not seen people. We thought we were successful at flattening the curve. And so therefore people started to say, well, it wouldn't hurt if I just saw so-and-so or if I just kept distance. But, over time, as you start to be social, sometimes you forget that you shouldn't have given someone a hug or you shouldn't have gotten closer than you did, those kinds of things. And so, over time, we kind of are where we are with a resurgence, right? And I think what's really, really hard right now is to be able to tease out, what of the resurgence is related to opening up economic activity or what is related to us just changing our social behaviors, right? And because those things are so hard to tell right now, I think the one thing that I will say is that I'm still hopeful that we can open up more of the economy so that we can get our budgets back online, so that we can get our supports back online, um, and to help people too. Because I think I think this was mentioned before, but I want to really reiterate it. There's a cost with shelter in place, right? And it's not just, we've heard a lot about the cost to business, the cost to losing jobs, which is not small. Those are big things when people lose their incomes, right? But there's also social and emotional kind of challenges, mental health challenges. Veronica spoke about social isolation amongst our seniors. We're seeing more of that happening. In terms of food insecurity, we're seeing more of that. There are also like the typical ability for us to be able to detect things like abuse, right? We're not seeing kids going back to school. We're not seeing more avenues for some of these things to be daylighted, for example. So it is not without other cost associated with it. So I just want to say that because part of reopening the economy and getting back to as much normal as possible is recognizing that there are other impacts associated with shelter in place that we have to see. Now, I do think that we can continue to do it, but we really have to double down in terms of our own social behaviors. That's going to be hard to do because all of us are so used to kind of being the social people that we are, and even if it's not that, it's just seeing your own family and so on. So I do think that what needs to happen in terms of the city and other actions that need to occur for us to make this not a here or there or a win or lose situation is that number one, we have to take more personal responsibility. All of us do. We just have to just remember to buckle back down again, right? And to not try to get together, to just do as much as we can to social distance and wear masks and those kinds of things. Those are all things that we can all individually take on ourselves to do. But I think as a city, we do need to think more hard about how do we support people during this time, right? So if we want people to not spread, it means that we need to support people who get sick, right? To make sure that they have a replacement income, that they are not going to lose their jobs when they do that. So I think that there are a lot of policies that need to happen that has to support economic activity to help people to be able to economically do and have good kind of health behaviors. And so I just want to say that we have a lot of work to do on the policy side, so supporting people who get sick, making sure that our public health continues to have the resources that it needs to help with mental health, with contact tracing, with testing. And then I think the last thing I'll just say is that we need to be thinking more regional. I think we started off really well in terms of kind of coming together as a region to kind of slow and close things down. But when we started to open back up, counties did it all different ways. And so there was a lot of confusion about what's open here, what's open there. But not only that, when things were open in another county, people from our county were, and rightly so, were saying, oh, I'll just meet you over there to have dinner, right? Or whatever it was, right? And I think, it just kind of shows you that spread isn't contained within our county, right? People they work in other counties, people come here to work. And so I think our lack of kind of having a regional approach when it came to opening really hurt us. And so I hope that we can get back on track with some of these things so that we can, come together and just be more coherent and cohesive about how we're moving together. I could talk for hours about this stuff.
So for me, Megan, and thanks, Carmen, that was wonderful. The question has a different turn for me. When I think about economic recovery or public health recovery, I have to add for who? Because our health was terrible before COVID. Our economic life was very poor pre-COVID. So when we're talking about the recovery of these things, if we're talking about Black people, we have to have a whole different conversation. The median income for white people in San Francisco pre-COVID was $101,000. For Black people, it's $29,000. Our health disparities are the worst across the city for every group. So it's a different discussion. Again, everything, all of the racism that Black people and people of color just in general experience is connected to economics, period. So it's not just about the pandemic. For my community, it's just heightened everything that was already in place and occurring. So when we talk about recovery for people who are already oppressed, already lax, and are impacted by the social determinants of health, the conversation has to take a different nuance. We have to have, again, honest conversations about what does recovery look like and for what population are we talking about? Because if you're already 2/3 up the food chain and the issue for you is this pandemic, but you still have food, housing, your bills are being paid, that recovery will have a whole different outcome for people who are at the bottom of the barrel. Right now, what we see, and I know Carmen and Joy have seen it, is the despair that everyone's feeling, the hopelessness, the uncertainty of how long is this going to go on? How is this impacting me? I've got people that I know that don't have jobs and are so afraid because they're going to end up losing their place they're renting because it's been so many months of I can't pay my rent. So when I think about recovery for people who are marginalized already, it's a whole different conversation. And I think I agree with Carmen. It has to have a regional approach. So we're not all doing our own little thing in our own little times based on the communities and the counties we live in. We do have to think about that. I just learned last week because of my exposure to data in the health department. I currently live in the census tract in the Bayview. I'm a native here, born and raised here, that has the highest cases of COVID. And I'm like, oh God, I'm scared now to go out my house, even for basic needs. And then there's people who are walking around that they're not thinking about public health recovery. They're not thinking about economic recovery. A lot of these people don't even wear masks. And they're not just the Black people. And so it has a different layer added to it for our community. And I'm going to loop back to what Joy said. That recovery requires the voices from our communities to be leading those conversations. Because what recovery looks like in Potrero Hill, Pacific Heights, Sunset is not the same as in the Bayview. Thank you.
I'll add really quickly.
Go ahead.
Some of the practical stuff, and I think that was a perfect segue into one of my points about like the community aspect. And so I was thinking, since young people are now one of the fastest populations to be contracting COVID, right? I have this crazy idea, like, why not hire them to be our contact tracers? They know who's been around and who's going to be somewhere and all this other stuff. Have them help us track this for us. It's their population that is now, sort of answering to this, because we didn't do a great job with our young people in messaging. So they have all kinds of different messages going on. Does the mask really help? I thought we can go here. Is this real? All these different things. And so like now getting them involved, getting them educated on what's gonna, like what's really happening, and helping them to be a part of the solution, I think is going to engage them, is going to help them in economic recovery. It's going to give them, experience that hopefully later on when we do settle on DPH, you now have your new public health team, right? Even hiring young people to be community ambassadors or captains, that's helping with some of the data collection in specific neighborhoods. I think about what's happening in Sunnydale and Hope SF. Hire some young people to help with that. Even in the shelter in place hotels, how can young people be, part of the staff? So I think there's ways that we can include community. And again, I'm using my youth lens because I run a youth organization, but community in general, like these are ways that we can incorporate the community in a way that does not make them feel tokenized, does not make them feel like you're just you already understand what you're going to do and you just want me to sit here and this is on the checklist. This is like actually having them feel a part of the solution and helping their own community in a way that is also uplifting them economically.
Yeah.
Can I add to that too, Megan, just for a
Please.
moment? I have we have a seniors group called Network for Elders out here, and I know the president, and she says they're just trying to communicate because so many of them live alone, and they don't even have laptops to do that because they used to meet monthly before COVID, and now because they don't even have laptops. I said, "How much do you need, Mother Beverly?" And she said, "Like 8." I said, "Wow." And they don't have the money to get it, but it's a way to stay connected and to be able to engage and feel like they are also part of whatever they can do to shift the narrative. So it could be small, but it's so critically needed. Thank you.
Yeah. And I love what Joy had to say about engaging the youth that way. I think it's a fantastic idea. The city has a huge need for contact tracers, and we're going to continue to have a huge need for a while, understanding that the resurgences can come and go, right? And so I really do think that that's an idea we should be exploring as a city. And then I think to Veronica's point, the digital divide is really terrible because you're also seeing that that's playing out in terms of education too, right? So as we're doing distance learning, if you have parents or kids who either don't have access to technology or the connection or don't know how to use it as well, you're really seeing that they're falling further behind, right? And so that's a huge challenge.
Yeah, and so really quickly, I guess a follow-up to this is what are some of the red tape that can be addressed that we can nix that and build some partnerships? You're shaking your head, Veronica. There's too much red tape. Too much. Okay, we won't have time for that, I guess. But something to think about, I guess, for everyone to address, and maybe there's some community building we can partner here later down the road. A question that we have from a audience member from Denise is how has the COVID crisis affected or complicated the housing crisis?
Yeah, I could take a shot at that. Hi, Denise. Thanks for your question. So immediately when shelter in place was enacted, we saw an uptick in young people trying to escape family violence, interpartner violence, just in a week's time. And it was just like, what are we going to do? And so before the city was really allowing the youth homeless response system to use emergency hotel vouchers, we just said, we're going to use them and ask for forgiveness later. So Third Street started commissioning sort of deals with the Ramada Inn, Holiday Inns out by the airport, just trying to get our young people somewhere where they can be safe. Started off as a week, started growing into a month's time. We thankfully were able to sustain them during this whole shelter in place time. It ended up being like 12 young people that we had to do this for, outside of trying to house. I think during this time we were rapidly trying to house all the youth who were on our list. So I think in addition to the emergency housing youth, we also housed close to 20 young people during this time. So things, it looks like rents are going down and stuff like that, but there's still a huge need. There are a ton of young people who are still in the queue, and we've had to slow down because of resources, right? Like it has been strapped because of all of the money that's had to go into the hotels, food, just making sure that everyone has the electronic stuff, right? Like laptops, hotspots, all of that. And so it's just put a huge strain on our resources. And again, there's still a lot more people in the queue waiting to be housed, even though rents are dropping. This, I think, is really like we went into this crisis with homelessness being one of our huge issues as a city. And we've done a better job of trying to address it, but it's only going to, like, it's a deep hole. So we need if I can advocate for anything right now, the two things would be housing / food and mental health. So I can say that, like, as a homeless response system in general, everyone, not just youth, everyone faced this crisis during shelter in place and even now.
Yeah, definitely. Does anyone else want to answer that question briefly?
I guess just quickly for me, it's just ditto Joy. And again, thanks Denise for asking that question. It's so complex. Our housing, our homelessness shot up. I mean, we've got 100 times more homeless people out here in the Bayview than we had before because resources shifted and things that used to be available in certain parts of the city weren't anymore. We even have people that are in housed, sheltered environments with no food and going to the homeless services to eat. So it's just, it's very complex. And I ditto everything Joy said. It's, you know, all three of these intersections have to be addressed because they're all happening at the same time.
Definitely. And so I want to open up to our kind of closing remarks and last questions here as we're coming to time. How has each of your personal experiences guided your strategy to recovery? And what are some resources that you can provide to our audience? And try to keep this under 2 minutes, and I think we'll be good.
I'll go very fast, which is, you know, my parents were immigrants here. And so my parents, I grew up most of my life with my parents facing racism, right? Because of the fact that they couldn't speak English well, and they often worked in low income jobs and so on as well. My mom was a seamstress when she first got here. My dad worked in the kitchens. And I think it's always colored my perspective because when I think about policy and how we respond to economic recovery, I always think about the people who can't make it to the table. I think about the people who can't come out and advocate because they've got to work, or I think about the people who either don't feel like they can speak up, right? And so I think that that's something that will always be with me, is just always keeping that perspective about who can't come here to say what they need to say, and that we need to be thinking about them too. And I think in terms of this pandemic, it's even more clear about how it is that we need to be protecting, especially our most vulnerable communities.
Joy, if you want to go.
Oh yeah, I'll go. I don't think you come out of Hunters Point without being an activist. And one of the most overused but appropriate words to describe our neighborhood is resilient. And so I think we've learned how to, you know, make something out of nothing. And I think, again, as I talked about earlier, the village model of really making sure that we all were helping each other no matter what. Even if we had something little, it was like, well, let me help you get this. And I think that's been sort of the beauty of all of this, is just seeing how San Francisco has come together to make sure that we are at least trying to address our most marginalized. Like I've seen people come out to help our seniors, like Veronica was talking about with the faith-based community and serving all those meals. That came from just conversations, you know, very organic conversations. So seeing that and seeing how the networking has, I've just really been amazed at how everybody has come together in all different fronts. And I think in terms of resources for the audience, I really want people to get out here and advocate, right? Like we've talked about all the things that need to happen. Get engaged. Look at like the next budget meeting. Look at the next police commissioner meeting. Look at like, you know, all these different meetings where we need folks to come out and advocate for the things that we're talking about. We're gonna need your voices to make this happen. This is where the community is at the table. This is how we shift the power in the decision making. We need you all to show up and advocate for these things. So I'll leave y'all with that.
And I'm going to end with very little. The resources I bring is food. There's people know me as, if you need food, call Veronica, because I pretty much know where all the food is and how to get it to people. But more than that, I bring grace. I bring dignity. I bring values and humanity to people's life who are suffering in multiple ways, in spaces and places, whether they speak English or not. I think that hope and, like Joy said, and the resilience that we have helps people helps people know that somebody cares and somebody really shows that they care about how we're experiencing life each day. I don't care whether you're giving a person a napkin or a referral. Do it with dignity. Do it with hope. Do it with grace, and remind people that they're not alone. To me, that's the most important. If we don't stand for the values that we say we represent, it doesn't matter what we have to offer. You could treat people very badly for something they really need, and they'll walk away from you because you've disrespected them. So I think that is critical of how to engage people, specifically in this pandemic. Thank you.
Thank you, Veronica, Carmen, and Joy. Your comments are much appreciated, and I hope the three of you collaborate down the line. So I just want to plug for Summer in the City is San Francisco Women's Political Committee's next event, August 6th. And this is a big event for all women to celebrate. And I know that Carmen also has the W Challenge coming up in celebrating the 100-year anniversary of women's suffrage. Both are tied to the women's suffrage, so keeping it in line with women's rights. And of course, what that means for women of color, especially Black women and Brown women. And so thank you again for everyone who is watching from your homes. A reminder to make sure that you are socially distant, wear your mask, and stay informed. Thank you.